Cynthia Layton noticed her 2-month-old's cough and wasn't taking any chances. Respiratory syncytial virus, or RSV, is on the rise. Cases are peaking in many states and can be most severe in infants.
We noticed that she was coughing a lot and had a really runny nose, and so we took her in to the doctor and they tested her, and sure enough, she had RSV.
In a lot of places, we do have the ability to test for sometimes COVID, influenza, and RSV all in one test that we can do in the office. Not every place has that, but some places do.
If they have any difficulty breathing, take them for medical attention.
Dr. Andy Shane explains most RSV infections last between 3 to 8 days, and usually the middle days are the worst. Most care will require keeping a child comfortable, making sure they can eat, sleep, and breathe. Sickness will look different in older children than in infants.
Younger infants can't really cough with a lot of force, and that's one of the things that happens with RSV is that the airways become even smaller than they are.
Doctors say the flu, COVID, common cold, and RSV symptoms are all very similar. For RSV, pay attention to any wheezing cough or panting-like breathing.
You'll see their neck muscles going in and their chest muscles going in, and that's very noticeable in a child who's lying down as well. And you might also see that their nose starts to flare out as they're trying to get more air and more oxygen into their lungs.
There is a monoclonal antibody injection usually given to patients who were born premature or who have underlying lung or heart conditions.
Wash your hands, wash your hands, wash your hands.
The CDC says children usually encounter RSV outside of the home. The virus can survive for hours on hard surfaces like tables and crib rails, and on soft surfaces like tissues or hands for a shorter time. In Colorado, Dr. Reginald Washington says most importantly, if your child is sick, keep them at home. Their story reflects much of the country's children's hospitals right now.
We are seeing a surge in all respiratory viruses, including RSV. We're not at capacity yet, but we have become very close, not only in our intensive care unit, but in our general medical surgical unit as well.
Their ERs are seeing a surge of patients too, parents bringing in their kids to see which respiratory illness they might have.
So depending on where you are in the country, you might be thinking about heading out to go trick-or-treating tonight for Halloween. So this is where I become the buzzkill. If you want to be protective, even more so against RSV, carry around that hand sanitizer for you and the kids. Try to even give them a pump of that sanitizer as you go door to door. And then I hate saying this, Del, but try not to let them have any extra treats before you get home and wash your hands.
But here's how I can redeem you. They can wear the mask and be politically correct this year. Lindsay Thies reporting for us from San Francisco. Lindsay, thank you very much.